Welcome back to the channel, future therapists, career changers, and all lovers of occupational therapy. Today, we are diving into one of the most important documents in our profession, the Occupational Therapy Practice Framework, Domain and Process, 2nd edition, also known as OTPF2. Whether you're learning OT documentation, preparing for fieldwork, or strengthening your clinical reasoning, understanding the framework is essential, so let's break it down in a clear, practical way. The OTPF2, published by the American Occupational Therapy Association in 2008, is more than just a guideline. It is a document that embodies the focus, heart and soul of occupational therapy. It describes what we do and how we do it. It also provides the professional language we use when writing SOAP notes, communicating with other disciplines, and justifying skilled care. The framework explains that the core of OT is supporting health and participation in life through engagement in occupation. That single sentence captures the full purpose of our profession. The domain outlines what we address as therapists. The framework organises everyday life activities into areas of occupation, such as activities of daily living, instrumental ADL's rest and sleep education and workplay, and leisure social participation. These areas represent the meaningful tasks that matter to the client, and our job is to help them engage in those tasks as independently and safely as possible. But occupation doesn't exist in a vacuum. Many interrelated factors affect the client's ability to participate in daily life. These include performance skills. These are observable, goal-directed actions. OTPF2 breaks them into motor and praxis skills cognitive.
Before we talk about documenting the occupational therapy process, we need to make one thing crystal clear. Occupational therapy isn't just another healthcare service. It's different. It's unique. And everything we document depends on understanding that difference. Occupational therapists and occupational therapy assistants specialize in one thing: helping people engage in meaningful occupations. Occupations aren't just jobs. They are the everyday activities that bring purpose and function to someone else's life. So, when a person has trouble engaging in an area of occupation, that's where OT comes in. And this is very important because this is exactly what we document. Our documentation must always align with the client's ability or inability to participate in occupation. When we're writing notes, this focus on occupational engagement is what demonstrates medical necessity, differentiates OT from other disciplines, prevents overlap or duplication of services. Every healthcare discipline has its own focus. PT focuses on movement. Speech focuses on communication and swallowing. Nursing focuses on medical care. But OT focuses on how these things influence the client's ability to perform meaningful occupations. That distinction keeps our documentation strong, defensible, and valued. No matter the setting, skilled nursing, home health, outpatient, schools, mental health, every OT practitioner has one shared goal: facilitating occupational role performance. Whether it's helping someone bathe independently, return to work, manage their home, engage socially, or participate in school, occupation is always the center point. Now here's where documentation gets even more important. Every funding source, whether it's Medicare, Medicaid, private insurance, workers' comp, or a school district, has its own priorities. They decide what services they consider necessary, interventions they will reimburse, frequency and duration they approve, DME or special equipment they will cover. Think hospital beds, splints, adaptive devices, assistive tech, custom wheelchairs. Your documentation must reflect the payer A's requirements, the client's actual condition, their living environment or context, and the realistic expected outcomes. Example, workers' comp wants to see how OT helps a client return to work. Medicare is interested in safety and independence with ADLs at home. School districts focus on a child's ability to perform tasks related to their IEP. When your documentation aligns with payer expectations, it becomes clear, defensible, and reimbursable. According to the Occupational Therapy Practice Framework, OT addresses 8 areas of occupation. 1. ADLs, bathing, dressing, toileting. 2. IADLs, cooking, cleaning, medication management. 3. Rest and sleep. 4 education, 5 work, 6 play, 7 leisure, 8 social participation. Every OT note, whether it's an evaluation, daily note, or discharge summary, should make it clear which area of occupation your intervention is impacting. So before we dive into how to document OT services, always remember, OT documentation begins with occupation, centers on occupation, and must end with occupation.